Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes. She's blowing around up here like a hurricane.
We're just so busy, excited, talking.
Yeah, so our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And we are so excited to have Dr. Leah Larson return with us
That's right.
tonight with Hightower Dental Concepts and talk about, because, you know, we had one of the docs on from Mary Bird Perkins talking about, because April was Head and Neck Cancer Awareness Month, and one of the things that they mentioned was a lot of times some of these lesions were picked up by the person's dentist.
Yes.
So let's talk about that. There's some reasons. Sometimes people go, well, why do I need to go every 6 months to see my dentist? Well, that might be one of those reasons, right?
It is absolutely. The scary thing about oral cancer is that there is no standardized testing in terms of the screening of the initial signs of oral cancer. So really the only way that you're going to be able to initially detect that there's something wrong is through your dentist, your dental hygienist, or seeing your physician once a year. But the physician is not always looking under those little crevices that we have all over our mouth that food loves to get stuck in. But I have to say, thank you so much for having me back. It is such a pleasure.
We love seeing you.
Well, thank you guys for letting me be a part of the community. I love being here in Baton Rouge. Our patients, I love the relationships that we make with our patients, and that even the relationships that we do have with our patients, it makes it even more important to make sure that I'm that first line of defense. Our hygienists, Allison and Sherry and Dr. Fernandez, that we are the first line, that we're making sure that everything is looking normal. So one of the things about what we're going to focus more on the inside of the mouth, because oral cancer, it can include the borders of your mouth, and so that's like another subject in itself. So we're going to talk about a little bit about the inside of the mouth. So the inside of the mouth, talking about the tongue, the floor of your mouth, the roof of your mouth, which includes that hard surface and then that soft surface, just like that the ear, nose, and throat doctor was talking about, and then you can get all the way to the back. So over 90 to 95% of oral cancers are related to the squamous cells. The squamous cells, it's a thin, flat cell that just lines most of the mouth.
Right.
Well, once you start seeing changes in that, that might mean that you could have cancer or something's going on. Well, what are some of those risk factors? Well, the biggest risk factor is tobacco use. So tobacco, smoking, vaping, chewing, pipe smoking. Another is heavy alcohol use. Another one I'm sure that the doctor spoke about was HPV, which is a sexually transmitted disease. And another one is a weak immune system. So with these risk factors, if you're using tobacco and alcohol, heavy use, it can increase that cancer by 30 times than somebody.
Isn't that crazy?
30 times is a lot.
And we live here in Louisiana, and most people, like to socially drink and smoke. So we got to keep an eye on what's going on in the mouth there.
Well, and of course, I'm glad that you brought out not just smoking, because people think that, I can do vaping that's safe, or I can do chewing tobacco and that's safe, but the chewing tobacco too. I mean, that's one of the big big causes.
Today,
so they're not substitutes.
No, definitely not a substitute. And they'll come out with more research on vaping. We're still waiting for that.
Right.
But regardless, we do have some great photos today.
Yeah. And I think we want to,
let's
go ahead and pull up that first one.
Surprising.
And
they are a little
Dr. Larson's going to tell us what this is. Now, again, you can't see the roof of your mouth very well.
No, you can't.
Most likely, that probably if somebody ran their tongue up against there, it would feel normal, right?
It would feel normal because your tongue gets used to feeling the mouth. To develop the roof of your mouth like that takes years. So it looks like a dried up river creek. And what that's called is actinic stomatitis.
So that is from smoking or any tobacco type
It
of use
is
in your mouth?
generally smoking and a lot of heavy smoking. And unfortunately, I've had pictures that are far worse than that that I've seen in the mouth. And we do recommend at some point getting that biopsy just to make sure that it doesn't transition into a cancer.
Right.
So that right there is a picture of that last picture
would
was a
be
picture of
pre-cancer.
And now
smoking.
let's look at this one. I'm sure somebody sticks their tongue out and go, oh my gosh, what is that?
And it's a really cool phenomenon. It's called geographic tongue. Now, if this is in your mouth, this is something that is absolutely normal.
There's probably people wanting to know where they can get that design on their tongue.
I've had a little.
People pierce a lot of stuff.
I've had some little areas on, when I've looked at my tongue, I'm like, what was that? But it didn't look near as designer as that.
I'm going to keep my dull tongue, my dull normal tongue. That really is a surprise.
It is
I've never
a surprise.
seen anything like that.
And that right there is not cancer. Now, this right here, this is a roof of a mouth, and it's on the that hard portion of the mouth. And as you can see, we have a little measurement right there because we continually, like I said, we'll take some pictures. And then if we're luckily, hopefully not seeing too many changes. So that right there is a soft bump on the roof of the mouth. And one of the things that I think that the head and neck doctor was talking about were those HPV-related cancers. And this right here, it is possibly, it has not been biopsied yet, is a papilloma. And what that is you can see that's just some round surface projection right there. And that can be associated, and let me just check with my notes here because I don't want to tell you something incorrect, but that's associated with HPV 6 and 11.
Which are usually the benign types, although they can they can be cancerous. They're not 100%, but they're less likely, and it's possible that person may have felt a little thing in their mouth because it's raised, or if it's really small, you could have just detected that on exam.
Or it's been there for years.
And they thought nothing about it.
They think nothing of it. But
if it's benign or if it's not benign, what would somebody do if they were to have that condition?
I recommend having it removed and having it biopsied because I'd rather be safe than sorry.
Absolutely, always. Now, what are we looking at here, Dr. Larson?
This right here, now this has not been biopsied. This is... So I can't give you the confirmed diagnosis because it really needs to be biopsied and looked underneath a microscope to have a confirmed diagnosis. But this is really towards the back of the throat, and we're getting close to the tonsils right there. You can see the edge of the tooth. And so when we do our exams, I'm having people say, and I'm really trying to see as far as I can back there. So this is actually the same picture, but it's we zoomed up on it, and you can see that this is it's a projection, and it has some white, stocky components on it. So, like I said, I don't have a diagnosis, but it looks like another one of those common HPV virus, also known as a Verruca vulgaris, and that can be associated with HPV 2 and 6. Now, like you were saying, there are over 150 different types of HPV. Excuse me there. What they have found that HPV 18 and 16 are your more malignant types. But any of them can do anything, and you don't know without biopsying even which it is. Now, what is this picture?
Now,
this is a picture of this is what happens when you put smokeless tobacco in your cheek. And just like with chewing, most people, they have a certain side that they like to put their snuff or their smokeless tobacco. So what eventually happens, you start building up keratin. That's that white stuff that you see.
Because your body don't like it.
No, and your body's trying to form something protective.
Sort of wall itself off from that evil stuff.
Kind of
Yes. And our biggest recommendation, because quitting tobacco is a very difficult.
It is. It's like any habit.
Yes.
It's hard to break.
It is hard to break, and that's one of those things where switch sides. You know,
And sometimes if people see these pictures, because they don't really know what's going on there, sometimes
That's correct.
that can make them want to
So
quit.
a lot of these pictures that we showed you today, you may not be able to identify them by yourself.
Sure.
And that's really why you need a dental professional or even a physician to be in there looking. But when we're in there looking at your teeth, we're getting in these crevices. We're looking underneath your tongue. We're looking in those hard to see spaces that are just super, super dark.
Right.
So some of the signs that that there may be something wrong is if you're having symptoms that persist 2 to 4 weeks. And what kind of symptoms are we talking about? Generalized pain in a certain area, swelling, white spots or red spots or black spots that just don't seem to go away. As well as you can get some bleeding. Teeth can start moving, hard ability to swallow. And I'm sure that the ear, nose, and throat doctor was
Persistent
talking.
sore throats.
Yes,
Yeah.
persistent sore throats. A change in your voice. That's another indication.
And
So-
change in your breath might also be an
Yes.
indication there's an infection or that there's something that really needs some care. And
Absolutely.
we can vouch for you about being not only very professional and thorough because you've taken care of our families, is you also are the most cheerful person. You are so cheerful. So if you're going to get bad news, you want it to be from somebody that's very, very nice and smiley and kind and very thorough and explains it very well. And you do a great job at that. You truly do.
Well, thank you. I really don't like delivering bad news, but
Right.
needless to say, it is our job, and we want to give people the most. We want to give them the most information so that they can make the most informed decisions that's best for them.
Yes, that's right. And so you
Yeah.
give them all that information. Well, thank you, Dr. Leah Larson.
Well, thank you so
You're
much,
also
Ms.
a Partners,
Betsy.
you're a Partners One member.
Yes.
We're Partners One members, and we're coming to you from the Partners One studio. So we're so glad that you could come and share all that great information with us. So we're going to share Leah's contact information, and we're going to be right back with her very handsome husband, Stephen Hightower with City Hospitality Group.